mean, just because it has a billing code now, right, that's been blessed. But I think the truth is, as you nailed, unless you're one of these integrated systems, really the payment system is structured around treating people when they're sick rather than preventing people from getting sick when they're well. And you're touching a lot on a lot of these things and techniques and technologies that have been there, but it's just this lack of built-in incentive for doing those things because you're only charged when there's a code and you're this transactional service or visit that's provided, which is really, I think, holding back, right, the industry from making those, big leaps that maybe you're able to make within KP or Intermountain is. But from the rest of the people, like your anecdote, they have this completely warped view of, gosh, the first question they're asking is not, how did the patients do? It is, how did you pay for it, right? And that's something I think we need to address.
Yeah, and I mean, I think that's where, I mean, that's just one example, and a lot, it's not like everyone is asking that, but that weighs
Right.
heavily on the mind of our healthcare system, right, and
Hmm.
physicians and administrators trying to design new systems, and it sadly shouldn't be, and it kind of distracts from the potential that we have to really,
Right.
I think really healthcare ecosystems are where the future is. And those
Hmm.
ecosystems should be augmented with virtual care. We have all these virtual care tools, whether you're bringing in intelligent virtual agents or chatbots and telemedicine, bringing direct to consumer. It's like I've always thought,
Hmm.
it's like, well, why don't we have medical food trucks that are getting out, that are getting out there to
Yes.
communities and bringing the care a little bit closer rather than creating
Yep.
the academic center as the center. Like everyone has to drive here to get your care. It's like, we have the capability to get more of that out there to them. We don't know how to bill for that yet. If we do remote patient monitoring and patient reported outcomes and
Hmm.
use digital tools to get more of the data instead of seeing everyone every 3 months, our system is built to see someone in a clinic visit or see someone in the hospital on these time intervals where their life is changing continuously. Right. And everyone's like, well, I don't want to be on call 24/7. I don't want to be, how do I know? How do I build a system around that? We just haven't designed a system like that. We can, and I think we will. And I think there's really interesting ways to make the system work with all the different tools we have
Yep.
in our toolkit. We can redesign a healthcare system that works better, keeps patients closer to their community, is more virtual, tries to break down some of
Yep.
the barriers of social determinants of health, geography and rural versus urban formats. But we have to, and as I was commenting, I was even on LinkedIn commenting on a post,
Hmm.
like yesterday. It's like, I'm in University of Kentucky where we deal with Appalachia, which, Wi-Fi, having people with smartphones, that there's a segment of the community that's not digitally connected. So if we make virtual care systems that are just, running and we're doing all our care, we are actually also leaving behind populations that, have to
Yep.
go to Wi-Fi or to get Wi-Fi, they have to go to like the McDonald's in their community maybe or something, or some other like place just to get wireless if they have a smart device, right? So
Right.
we have to like think also about like, how can we help bring other communities along? Because, digital health isn't going to solve all those problems.